Assalamu alaikum. Today we are going to start kidney. Here you can see that in front of you there's a diagram shown, but in order to understand any or viscera or any organ, you must know that what is its normal anatomy, physiology, and then you will understand clearly that what is its pathology, right? If you know that what a normal structure or what a normal thing looks like, then it would be easy for you people to find out or to spot any abnormality in that particular area. As in your first in your book, the first topic is glomerulonephritis. Glomerulonephritis mainly means the itis means inflammation, so here is the inflammation of the glomerulus. So in the kidney, that you know that there is about 1 million of the nephrons in your kidney. Here is the structure of a nephron shown, and in that nephron this is your glomerulus. You already know this. And what is glomerulus? Glomerulus is nothing but a tuft of capillaries, or a loop of capillaries. And this is the efferent arteriole. Then these they form a capillaries or a tuft of capillaries, and then comes this afferent arteriole. We are concerned with this structure. In all the types of your glomerulonephritis, there is inflammation of one thing is that there is inflammation of the filtration barrier. Now see, what is the filtration barrier? Look at it carefully and try to listen it attentively if possible. It will be very easy for you, inshallah. Here you can see that, just suppose that this is Bowman's capsule, cup shaped Bowman's capsule, and after this is the glomerulus, and here is the Bowman's space, and this is efferent arteriole, and this is afferent arteriole. From here the blood is coming inside, and from here the blood is going outside. What is the function? Just recall that what is the function of a normal glomerulus? The function of a normal glomerulus is to produce filtrate, is to produce glomerular filtrate. It's to do filtration. So here, what thing do filtration? Here in the glomerulus there is a filtration unit mainly. That's purpose is to do filtration. Here you can see that this is the your filtration unit, and that filtration unit is mainly responsible for doing filtration, and it is a triad of three things. Suppose that we have taken a section here, and this is your capillary, one capillary is shown here, let's suppose, and this is your capillary is lumen, and outside this these are the endothelial cells of the capillaries, and between this is mainly fenestrated capillaries. You must know that there are two types of the capillaries in your body. One are the continuous capillaries, and the other ones are fenestrated capillaries. You must have read it in your general anatomy. And so here in your kidney these are fenestrated capillaries, and the purpose is to pass out the filtration, or the material that is filtrated by your glomerulus. So one thing is that this in your filtration unit, okay, one thing is your endothelial cells, then comes this basement membrane in sky blue or whatever color it is. This is your basement membrane is for the three portions, we will discuss it later. And then comes your this portion, which is visceral epithelium, or it is also called podocytes. Podo, what podo means? Podo, just like we use word pedal for our foot, so podocytes also means, podo means foot. These are mainly the foot processes, and this is also known as the visceral epithelium. And after that comes the parietal epithelium, okay, but it doesn't form a part of this filtration unit, right? So here is another structure. You can also clearly see that again this is your capillary endothelium cells are shown. Okay, here will be the capillary lumen. Okay, and here the fenestra are present. These are mainly fenestrated capillaries. Then come the glomerular basement membrane, and after that comes the podocytes. And in podocytes there are some spaces which are called filtration slits, and in these filtration slits mainly nephrin is present, and nephrin forms interconnected chains and connect these two podocytes with each other. And inside this podocyte, podocins are present, as I am mentioning here, because you will see later that in some types of the glomerulus there are in some types of the glomerulonephritis, sorry, there will be the cases where mutations of these nephrin genes or podocins genes will occur. So this glomerular basement membrane is mainly divided into three portions. The central portion is actually the laminar densa. Like I am making it dense because as its name shows that it is very dense, it is laminar densa. On inside side there is lamina rara interna, and on outer side there is lamina rara externa. I hope so that this will be clear to you. This is the ultrastructure of your glomerulus, or mainly filtration barrier or filtration unit of glomerulus is shown here. Here you can see that this is the basement membrane, this is lamina densa, inside there is the lamina rara interna, and outer side, on outer side there is lamina rara externa. Here you can see that there are the foot processes, okay, or podocytes, and on inside this is the capillary lumen shown here, and these are the endothelial cells, and in between these fenestra are shown as these are fenestrated capillaries, right? Okay, as you can see that their shape somewhat looks like a foot. How your foot is present, like your foot is just like a structure of this type now, and these foot processes are also looking more or less the same. Okay, so I hope so that this will be clear now, and we can see like this is the picture of your big robins or medium robins. I will show you from there. Here you can see that this is histological diagram I'm showing here, because if you know the how the morphology or the histology of a normal glomerulus, then it will be easy for you people to spot any abnormality in the case of diagnosing the morphologies or diagnosing the pictures in your OSP of glomerulonephritis. Here you can see, here you can see clearly that in these ring forms, maybe you are appreciating it. Okay, these are your what are these structures? These are your capillaries. Okay, inside it in white color, this is your capillary lumen, and outside, immediately outside the capillaries is what? These are the foot processes, and between the capillaries is your mesangial cells, like here shown. It is somewhat difficult to spot the mesangial cells in the slide picture, but you can say that between these two, between the two capillaries are the mesangial cells actually present. I have not mentioned you what are the mesangial cells. I will tell you in the picture of your medium robins or big robins. Okay, so I hope so that all of these pictures will be clear to you. Here you can again see that this is the efferent arteriole, and these are your capillaries. Okay, and after that this is the afferent arteriole, and these between your capillaries, mainly here are some supporting cells which are called mesangial cells, or we can also call it as mesangial matrix. Okay, these are also called filler cells because they fill the gap, or we can say that they are supporting, so we call them so. Here you can see that on the inner side of the one second. Here you can see that on the outer side of your capillaries are the podocytes. Okay, these are the podocytes, and on the inner side of the capillaries, uh, like these are the glomerular capillaries. On the outer side, these are the podocytes. Okay, okay, and on the inner side of the capillaries, like somewhat here must be the here must be the endothelial cells present. Okay, let's have a review of the medium robins picture. Okay, so this is picture of your medium robins, and it is also given in your big robins. You can see that this is the this is our normal glomerulus, efferent arteriole, and we are taking its cut section, like you're cutting this glomerulus from here. Now you're standing here upright this glomerulus, and you are watching from here. Okay, so somewhat the glomerulus will look like this. Here you can see easily. Now let's repeat that what was the filtration barrier. Here you can see that these are the fenestrated capillaries, and outside it in a light pink color somewhat there is the basement membrane, and outside it in light blue color, here the light blue color, these are the your podocytes or visceral epithelium. Okay, outside it this is the parietal epithelium, but this is not a part of your filtration unit. We are concerned mainly with the filtration unit here. So again, this is again the your capillary lumen. Okay, fenestrated capillaries, and outside it this is the in light pink color, this is your basement membrane, and on light blue color or sky blue color, these are your podocytes. So we are mainly concerned with it. This is another capillary. You can see it clearly, appreciate it clearly, and between these capillaries, these are the mesangial cells or supporting cells or filler cells, right? Okay, so this was the normal structure. I hope so that this will be clear to you. Here in ultrastructure, you can see again that these are if this is the and if this is your capillary. Okay, and outside these are your these are your mesangial cells. Okay, here your mesangial cells. This is the capillary lumen inside. So I hope so this will be clear to you. This picture I have shown you before. So thank you very much.